our episode, Hair Transplant, Step by Step FUE, episode number 7. Today we are talking about who is performing my hair transplant surgery. Now that is one of the questions which many times people miss, though they are very conscious about it, but at the same time they miss to really pinpoint it while they are going for the surgery, while they are deciding or finalizing for their surgery. Now, why this question arises that who is performing my hair transplant surgery? Hair transplant surgery is a little different as compared to other surgeries, and at the same time, it is a little different as compared to other medical fields. Most of the times, with any of the other surgeries, say for example, you are going for your knee replacement surgery or appendix surgery or anything else, you select a doctor, you select a center, you go ahead with the surgery there, doctor performs the surgery, it's done in given time, 1 or 2 hours or so, and then the post-operative care and things are done. Hair transplantation, on the other hand, it's a lengthy procedure. It's not finishing in 1 or 2 hours unless it's a very small session. The usual sessions take 4 to 5 hours and sometimes even longer if they're involving more number of grafts. Along with the length, the art part of it is something which has to be taken care of. It's a very minute work of taking out hair one by one and implanting that back in place one by one. And this whole minute work of extracting 3,000, 4,000 grafts and implanting 3,000, 4,000 grafts, it's not one man's job. Only a single person cannot finish the whole surgery. It's practically impossible. And if a single person tries to do that, so then the surgery time ends up extending to a great extent, which is in turn not good for the growing hair. That is why hair transplant from the beginning has been a teamwork. It is never a single person performing the surgery, it's always a team of people performing the surgery. Now that is where the confusion starts. Who is this team of people who is going to perform your surgery? There are multiple combinations which can happen. The first is the surgeon to whom you have gone to and plus its team. I would call them as the staff who are constant with that particular surgeon. The other combination is you have gone to a corporate center where you have met some of the counselors or dermatologists counseling for your hair related queries, and when you fix up for the transplant, there are designed teams of people which includes a surgeon and technicians who are performing the surgery for this particular corporate all over the places. So those are the whole team which is moving from place to place, which has a doctor and technicians. The third scenario is you go to a doctor, you get them your consultation, you fix up your transplant surgery, and that doctor calls someone else who is good enough in performing this surgery, who comes with their team, who is a changing person or team. On one particular day, that doctor is free, visits and performs the surgeries. On another particular day, if that doctor is not free, some other person come and performs the surgery. Now the third scenario is there are wandering team of technicians itself. There are no designated doctors inside it. The technicians themselves have formed multiple teams who visit different doctors from time to time and perform the surgery as decided or defined by the doctor. So those are the teams of technicians. Now, in all the scenario, they are going to do the same work of extracting the hair and implanting them. It is a safe procedure, very less chances of complication, but still the quality of result that you are getting differ in all the scenario depending upon the operating person's expertise. I usually give this example to my patients. Say for example, you take up drawing. What do you need in drawing? You just need to draw a few lines, fill in some color, and your drawing and painting is ready. But even for such a simple task, everyone cannot do nice painting or nice drawing. You need to have that art to do good painting. So that is why the person who is performing, who is doing the painting, is a center point. If you have a good painter, you end up getting a good painting. The same thing happens when you are going for a surgery. The person who is performing the surgery is the main important factor to decide the outcome of your surgery. In all these three scenarios, depending upon your comfort level, you can think that which one can be the best scenario. But meeting the surgeon who is going to perform your surgery, or having a consultation with that surgeon who is going to perform your surgery, and then undergoing the surgery under that person with his or her own staff, not wandering people from here and there, but people who are doing the same procedure with that particular doctor all the time. Everything is tuned up, everything in and out, time wise, everything has its own harmony. That is the first scenario. In second scenario, yes, there is a doctor along with the team, but probably you have not met that doctor. Probably you don't know the name of that doctor. That happens. This has happened in many instances, that when we ask patients who have come for their second or third repair hair transplants, we ask them whom you undergo your first session. They don't know the name of the doctor. They just know the name of the clinic or the center or the corporate that they've undergone. But there is no face to that doctor. Now, here, when you are getting done your artistic work done from a person whom really don't know, about the person whom you have really not done any research. So then the outcomes that you are expecting out of it may vary. Of course, the person, the doctor inside that team might be qualified enough and very well. But still, you just need to do a little bit more research if you're going ahead with the second scenario. And the third scenario, team of technicians. Now, this is something which you really need to be, I would say, aware about. Now, what is happening is, in hair transplantation, there are two steps, extraction and implantation. According to international guidelines, according to ISHRS, which is the International Association, the extraction process has to be done by the doctor in all the scenarios. And in implantation, the slit making process has to be done by doctor. The implanting hair roots inside them can be taken over by technician. These are the international guidelines. But when technicians are performing the whole steps, right from beginning to the end, there is something which is not going right there. As we discussed in previous episode, there is so much to it. In a simple extraction process, there are so many things that you need to be careful about in order to get a good and healthy graft. The punch types and varieties, the equipment types and varieties, your artistic hand, your implantation techniques. And if the technicians who are performing the surgery, who actually should not be performing the extraction, they are still doing it, probably you cannot expect the same outcome as you are expecting from a more qualified person. So team of wandering technicians, that is something that you need to be aware about and something that you need to clarify before you really undergo your hair transplant surgery. So many times you would have found that the price range for the surgery, the cost of the surgery varies widely from place to place. Sometimes you get the surgeries done at very, very cheap rates, and sometimes you get them done at little more expensive rates. You may think that why such a big difference? Why few centers are charging so less and why few centers are charging so more? Well, the difference is in short, in quality and in depth in multiple things. So when you have less qualified people, less good people performing the surgery, in fact, in some instances illegal people, then you can still get your surgery done at less rates, but then you cannot expect the same kind of results. While you have better people, more qualified and more professional people performing the surgery, the charges may be high, but then accordingly you are expecting the outcomes. So that is why this one question you really need to address before you decide for your hair transplant surgery, that who is going to perform your surgery. And once you are able to address this question, most of the doubts are taken care of. I hope this was informative enough. See you in next episode. Thank you.